Introduction. Welcome, medical students, to today's lecture on the pathophysiology and management of diabetic cardiovascular complications. In this comprehensive session, we will explore the intricate mechanisms underlying the development of cardiovascular disorders in patients with diabetes, as well as discuss the current understanding of preventative and therapeutic approaches. Diabetes, a chronic metabolic disorder affecting millions of individuals worldwide, results in various complications. Vascular complications, in particular, pose a significant challenge and contribute to the substantial burden of disease among diabetic patients. Our objective today is to delve into the multifaceted aspects of diabetic vascular complications and their impact on cardiovascular health. Now, let us proceed to the first topic of our discussion. Diabetic vascular complications comprise a spectrum of disorders, including macrovascular diseases, for example, coronary artery disease, peripheral arterial disease, and cerebrovascular disease, and microvascular complications, for example, diabetic retinopathy, nephropathy, and neuropathy. The development of these complications is closely linked to persistent hyperglycemia, which initiates a cascade of pathological events within the cardiovascular system. Hyperglycemia, a key hallmark of diabetes, plays a detrimental role in the development and progression of cardiovascular disorders. Chronically elevated blood glucose levels contribute to the impairment of endothelial function, activation of inflammatory pathways, and dysregulation of various signaling pathways involved in vascular homeostasis. These effects collectively contribute to the increased risk of atherosclerotic plaque formation and subsequent cardiovascular events. Endothelial dysfunction, characterized by impaired nitric oxide availability and increased endothelin-1 production, is a pivotal mechanism in the pathogenesis of diabetic vascular complications. Hyperglycemia-induced oxidative stress, inflammation, and altered nitric oxide synthase activity disrupt the delicate balance between vasodilation and vasoconstriction, leading to endothelial dysfunction. Moreover, dysfunctional endothelium further promotes platelet aggregation, leukocyte adhesion, and vascular smooth muscle cell proliferation. Oxidative stress, an imbalance between reactive oxygen species, ROS, generation and antioxidant defense mechanisms, contributes significantly to the pathogenesis of diabetic cardiovascular complications. Hyperglycemia-induced mitochondrial dysfunction, advanced glycation end product formation, and activation of pro-inflammatory pathways augment ROS production, leading to endothelial dysfunction, lipid peroxidation, and oxidative damage to DNA and proteins. This vicious cycle perpetuates vascular inflammation, oxidative stress, and ultimately, cardiovascular complications. Chronic low-grade inflammation plays a critical role in the initiation and progression of atherosclerosis in patients with diabetes. Hyperglycemia triggers the release of pro-inflammatory cytokines, such as interleukin-6, IL-6, and tumor necrosis factor alpha, TNF-alpha, which activate endothelial cells, recruit monocytes, and promote the transformation of macrophages into foam cells within the arterial wall. Additionally, dyslipidemia, another hallmark of diabetes, further exacerbates vascular inflammation and accelerates atherosclerotic plaque formation. The formation and accumulation of advanced glycation end products, AGEs, contribute to the pathogenesis of diabetic vascular complications. Hyperglycemia promotes the non-enzymatic glycation of proteins and lipids, leading to the generation of AGEs. These AGEs induce endothelial dysfunction, amplify oxidative stress, stimulate inflammation, and activate profibrotic mechanisms, ultimately driving the development and progression of cardiovascular disorders such as endothelial dysfunction, atherosclerosis, and myocardial fibrosis. Apart from macrovascular diseases, diabetes also predisposes individuals to various microvascular complications. Diabetic retinopathy, nephropathy, and neuropathy are the most common manifestations, leading to vision loss, end-stage renal disease, and peripheral nerve damage, respectively. The underlying mechanisms involve chronic hyperglycemia-induced oxidative stress, impaired growth factors signaling, and dysfunction of the microvasculature. Understanding these processes is crucial for implementing effective management strategies to prevent the progression of microvascular complications. Dyslipidemia, characterized by increased triglyceride levels, decreased high-density lipoprotein cholesterol, and abnormal low-density lipoprotein cholesterol particles, significantly contributes to the development of cardiovascular disease in diabetic patients. Insulin resistance, hyperinsulinemia, and dysregulation of lipoprotein lipase activity disrupt lipid metabolism and promote the formation of atherogenic lipoprotein particles. These lipoproteins undergo oxidative modification and promote foam cell formation, thereby accelerating atherosclerosis. Diabetic autonomic neuropathy, a widespread complication of diabetes, affects the autonomic nervous system and impairs cardiovascular regulation. Vascular sympathetic denervation leads to altered heart rate variability, exercise intolerance, and orthostatic hypotension. Moreover, parasympathetic dysfunction contributes to cardiac arrhythmias and increased mortality. Understanding the mechanisms behind diabetic autonomic neuropathy is vital for the early detection and management of cardiac dysfunction in diabetic patients. Hypertension frequently coexists with diabetes, heightening the risk of cardiovascular complications and worsening chronic kidney disease. The interplay between insulin resistance, endothelial dysfunction, mineralocorticoid excess, and sympathetic overactivity contributes to the development of hypertension and diabetes. Targeting hypertension in diabetic patients is crucial for reducing cardiovascular mortality and preserving renal function. Intensive glucose control, along with multifactorial management strategies, has been the cornerstone for preventing and treating diabetic cardiovascular complications. Emerging therapeutic approaches targeting specific pathways, such as mitochondrial dysfunction, inflammatory signaling, ages formation, oxidative stress, and endothelial dysfunction, offer promising avenues for improving clinical outcomes in diabetic patients. We will discuss innovative interventions and their potential impact on cardiovascular health. To establish evidence-based management strategies, extensive clinical trials and epidemiological studies have been conducted to assess the efficacy and safety of various interventions in reducing cardiovascular risk in diabetic patients. These trials have examined the potential benefits of lifestyle modification, pharmacotherapy, and multifactorial interventions on cardiovascular outcomes. Understanding the results of these studies will empower healthcare professionals to make informed decisions when managing diabetic patients with cardiovascular complications. In conclusion, diabetic vascular complications represent a complex landscape intertwined with numerous intricate mechanisms. Persistent hyperglycemia, oxidative stress, inflammation, endothelial dysfunction, dyslipidemia, and autonomic neuropathy are pivotal contributors to the development and progression of cardiovascular disorders in diabetes. Understanding these pathophysiological processes is essential for developing effective preventive and therapeutic strategies to mitigate the burden of diabetic cardiovascular complications.